From the studios of WWAY News Channel 3, this is your hometown show, Health Beat Edition, a program dedicated to health and medical issues from experts in the Cape Fear area.
Today we'll be talking and learning about an issue that is very important to many, many people. In fact, over 70 million people. And that issue is chronic back and neck pain. Hello, I'm Grace M., your host for the Health Beat edition of your hometown show. Today we'll be visiting with Dr. Jason Graf. He is a specialist in the treatment and resolution of this very serious condition here at Spinal Care of Wilmington at their new location at 211 Racine Drive. Chronic back and neck pain can be caused by a myriad of issues. Fortunately, the more common ones, although very serious and very painful, can be treated. Usually, it's caused by some kind of a pressure on a nerve in the spinal column. That may sound very simple, but that kind of simple pressure can be debilitating in pain to many, many, many people. People who have tried injections, drugs, even surgery without any guarantee of success. Let's talk to Dr. Jason Graf and find out about a non-intrusive way to treat this condition, spinal decompression. Dr. Graf, thank you so much for letting us come here to your new offices to learn more about spinal decompression.
Welcome. I'm glad to have you back.
Thank you. I know that some of our viewers may have seen you before and know a little bit about it, but truthfully, when I was reading up on this, it seems like a miracle space-age cure. So please tell us about spinal decompression and what you do here.
Yeah, it does work very well. How I originally got into it, I've been a chiropractor for about 9 years now, and so I've seen a lot of patients that have chronic and severe back and neck pain issues over that time span.
Right.
And a lot of them I could get, quite a bit better, but there's a select few that you just can't get to a certain point, and it's frustrating as the doctor. So you get to a point in the patient's treatment where you need to refer them out to whether it be for pain management or injections in their spine or even surgery in worst case.
Right.
And a lot of times the patients would come back, they don't want their pain managed with pills or injections in their spine, or if they even had surgery, sometimes they come back even worse or no better at all. And that's frustrating not only for the patient, but as a doctor as well. You want to actually fix their problem, not just manage their pain. So that's how I got involved with the spinal decompression. I heard about it and read on how it actually works and repairs the discs in the spine. And that's when I decided to jump in full bore with this.
So there are issues that are absolutely treatable with the spinal decompression treatment.
Oh yeah.
And what are those issues?
Mainly disc injuries, and that would involve like a disc bulge or a disc herniation, whether it be disc degeneration, sciatica, spinal stenosis. Those are the main things that we treat here with spinal decompression.
I see. And how would a client know if they were the appropriate candidate for this kind of treatment?
Usually it's a sharp and chronic and severe type of lower back pain or neck pain, and usually it will radiate whether into your arm or down your legs, one leg or both legs. Sometimes you may have weakness, numbness and tingling, loss of sensations, the feeling of sharp shooting pain down the leg or the arm. Those are the types of symptoms that we usually see when people come in. And these are things that aren't treatable with traditional treatments such as pain medicine or physical therapy or injections in the spine. Those are the types of patients that I typically see.
I see. So if it's just, oh, my aching back, that's not quite enough. You want to know that it's those shooting pains down the extremities.
Right. If it's just like a soreness or just a kink in your neck, usually that's treatable with whether it be chiropractic or massage, something like that.
Okay, but this is a huge piece of equipment, and it's going to decompress the spine. How does it do that?
Basically, what it does, it takes pressure off the actual disc, and it gets pressure off the nerve that radiates into the legs and to the arms.
I see. Would you have a client maybe that...
Yep, I actually have somebody coming in just a few minutes if you want to stick around, and I'll actually put him on the table and walk you through the decompression process.
Okay, that sounds like a great idea.
Sure.
Thank you. Stay with us. We're going to be here with Dr. Graf, and there is going to be an actual client experiencing this process of spinal decompression when we get back here at Spinal Care of Wilmington. For more information, you can contact Dr. Jason Graf, Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, www.spinalcareofwilmington.com.
If you're interested in being a guest on HealthBeat, call 762-8581 or go to our website, www.aytv3.com.
Welcome back to this HealthBeat edition of Your Hometown Show. We're here today at Spinal Care of Wilmington visiting with Dr. Jason Graf, where we are learning about spinal decompression. This is a non-invasive treatment for chronic back and neck pain. What does that mean? It means no needles, no drugs, no injections, and most of all, no surgery, for a way to relieve that awful excruciating pain that comes from back and neck problems. So we're here and we're going to see if we can talk to Dr. Graf and find out what's going on with this patient on the table. Doctor, here we are again. Now, this is a fabulous machine. Tell us what's going on here.
Okay. Here you see you got Mr. Barnes on the decompression table. Obviously he didn't climb up there. Before we put him on here, this table actually will tilt all the way up. So it'll be standing straight up.
So he starts in a standing position.
That's right. That's right. Once he's standing, I put a harness around his lower rib cage and another one around his pelvis as he's standing. So once I have the harnesses on, he would just step onto this platform, which would actually be on the ground.
Right.
So once he's standing there, I just tilt him down into this position, because obviously with back problems, you don't climb up to something like this. It's very difficult, so we have to make it as easy as possible. So once he's in this position, I put a little wedge under his knees to prop his legs up, and that takes pressure off the lower back.
Exactly.
To make it a little bit more comfortable. And this is nice and soft, so it's not hard or anything. Very comfortable. Once this is on, I attach that lower harness to the actual decompression unit. Now, this particular piece of equipment has 3 different computers inside of it. One of the computers is down here, where it changes the angle to isolate the specific disc in his spine that I'm working on.
So you can get that specific to know exactly where on his spine you need to do
That's right.
the treatment.
Yeah, I'm not doing his whole lower back, just that one disc that was injured.
That's amazing.
It's very specific. So for him, it was L4. So I hit L4, and it changes the angle to that specific level in his spine.
Amazing.
The second computer in this will cycle through what's called a logarithmic decompression cycle.
Yes.
Okay, this logarithmic cycle is designed to prevent the muscles in his lower back from reacting to the procedure, which basically means he stays relaxed. The muscles relax, and what happens is that disc starts to open up, creates a vacuum in the disc, and pulls the bulging material back in. Okay, that's only the second computer. The third computer is internally, and it's monitoring any movement or resistance 17 times per second. So if he coughed or sneezed or moved his head or talked, it's going to automatically adjust, and I can watch all the adjustments right here on this line. So if I saw that squiggling up and down quite a bit, I knew he's very uncomfortable, so I can make some adjustments during his treatment. But Jack looks like he's pretty comfortable. It's not moving too much. So this procedure is very precise and very controlled with all these computers.
That's amazing.
Now Jack, he had a bulging disc in his lower back, and basically what that is, the little disc in between the bones, okay, they're round and oval shaped, and the outside of the disc is kind of like a crisscross mesh pattern. Inside of that mesh is an inner jelly area.
Right.
What happens with a bulging disc over years of wear and tear and bending and twisting and trauma, these outer mesh bands slowly start to tear apart and allows that inner jelly stuff to push out through. When that pushes out through, it hits a nerve, and those nerves go down your legs or they go into your arms. So that's why I said earlier that most people that I see, they have pain radiating into their extremities.
Just the explanation of it sounds painful.
So obviously, logically, somehow we got to suck that bulging material in and allow these fibers to bend back together. And that's exactly what the decompression does. By decompressing the disc, it creates what's called a negative pressure internally inside the disc. Now, negative pressure, it's like if you step in some wet, goopy mud or down at the beach, some wet sand. When you pull your foot out, your shoe gets stuck, you get that suction, that's negative pressure. It's like a little vacuum. So it literally will suck that bulging material back inside, getting pressure off the nerve. No more pain down your leg or no more pain in your arm.
Amazing. So that it's actually almost pulling the discs apart a little bit, allowing that gel to go back inside.
That's right. But that's only the first part.
Okay.
We've sucked the bulge in, but those fibers are still torn. Okay? That needs to be fixed. Because if they're not fixed, it's going to bulge out again. All right? So what happens next, when some of the research was done on decompression, they also found that the negative pressure we create, that suction, that's enough to stimulate what are called fibroblastic cells that come and start binding to these tears, and it undergoes what's called fibroblastic reformation, which basically means, in medical terms, those fibers start getting mended or glued back together.
Amazing. So now, this is a totally painless process, is it not?
It's absolutely painless. Usually we keep the lights off. Most people just fall asleep while they're in here. Okay. You know, if they want, they can watch a video. They can listen to music while they're in here. We want them to be as relaxed as possible because, remember, some of these muscles can tighten up.
Amazing.
So the more relaxed you are, the better the treatment.
Okay. When we come back, we are going to be talking to Jack, who's here on the table, and find out exactly how painless this is. So stay with us. Come back. For more information, you can contact Dr. Jason Graf. Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, www.spinalcareofwilmington.com.
If you want more information on today's HealthBeat show or information on other HealthBeat topics, visit our website at www.aytv3.com and click on HealthBeat. Also, if you have a health-related question, email us at healthbeat@wwaytv3.com.
Welcome back. I'm Grace M. Swartz, and this is the HealthBeat edition of Your Hometown Show. If you've been with us, you know that we're talking today about chronic neck and back pain and a treatment called spinal decompression. This is a non-invasive treatment for this chronic pain that is totally non-related to drugs, injections, needles, and best of all, no surgery. But what it does bring is relief and results. In front of us here we have a piece of equipment that is specific to spinal decompression. It's run by 3 computers. And we have with us here a Mr. Jack W. Barnes, who is actually in the process of receiving one of these treatments. Jack, thank you for being with us here today. How you feel?
I feel great. There's no feeling whatsoever. It's just lying here and letting this machine do its job, and it does a wonderful job.
Well, Dr. Graf tells us that there's actually a process going on where you're getting a little space in between your spine, and those fluids are going back into place where they're supposed to be, and you don't necessarily feel anything?
Not one thing, but that's the truth. It works that way. It pulls it apart and sucks that disc
Fluid
back
back
up in the vertebrae and then heals it.
Now, how many times have you been on this machine?
How many times have I been on this machine? Altogether, you don't want but both times. Well, let's go back and let's start with.
Start at the beginning for me.
About 4 or 5 years ago, I had the most excruciating pain I've ever had in my life. If you've ever had a pain in your butt, then you know what I'm talking about, because that's where that pain ends up and then goes down your leg. So, of course, I went to my doctor. Then I tried the physical therapist. Then I tried the back institute over there with those high-powered doctors. They MRI'd, gave me 3 cortisone shots over a 6-month period. None of it did any good. I ended up with a chiropractor in Hampstead. He helped a little, but the masseuse did more good than anybody else. But that didn't cure the problem. And I kept seeing the ads in the paper about spinal decompression. And so I picked up the telephone, I called that number, and Dr. Graf answered the phone. I told him, I said, I don't believe that machine will be worth a you-know-what. And he said, he said, well, there's one way we can find out. You come on down. And I did, and he examined me, and we agreed that I would start the series of sessions. And after 4 sessions,
Right.
the pain was practically gone.
4 sessions.
4 sessions. After 8 sessions, the pain was gone. But we set up for 20 sessions.
I see.
So I completed the 20 sessions, and after that I felt like a 20-year-old again. And when you're 80 years old and all the parts are already worn out, and you feel that good, you go back to playing golf or doing whatever, you're working in the garden,
Right.
cutting your own grass. Well, it feels so good. So that was the extent of it. And there's never been a machine like this, not since the wheel or the cotton gin.
Oh my goodness. So tell me, is that your only time that you were on this machine? Did the pain ever come back for any reason?
After the first session? No, it didn't until about 8 months later. And then, but it wasn't the machine's fault. I got stupid, went out, cut down a 10-inch tree, lifted about 150 pounds, and pulled that disc out, the disc out again. Woo! I came back in a hurry, and this time it took 22 sessions to get that thing back in there. But you better believe I don't lift anything more than 20 pounds anymore.
So the machine worked perfectly both times. And why are you sharing your story with us today?
2 reasons. First of all, if that disc comes out again, I want access to this machine, and when I call Dr. Graf, I don't want no howdy do. I want him to say, bring it on. And the other reason is, and I'm sincere about this, because I went through a lot of pain, and if what I say here today will help someone else to realize that there's a machine like this that will take the pain away, then it's worth my while.
Okay. Well, let's see if we can't talk to one more satisfied customer. Well, we're here with another very happy and satisfied customer, Ms. Marie North. Hello, Marie.
Hi, how are you?
Good, thank you. Thank you so much for being here and sharing your story with us.
Thank you. I'm happy to be here. Happy to be doing so much better.
Oh, that's good. Tell me exactly what was it that brought you to Dr. Graf?
Actually, I had experienced pain probably for a couple of years, and, you know, it would never go away, but it would get a little better and get worse again. And then one day last summer, I was stooping down, putting my dog's food on the floor, and my back went out, my low back, and the pain was just excruciating.
So we think a disc ruptured or?
Yes, the doctor I was seeing at the time sent me to have an MRI done, and it showed that I had one ruptured disc and one that was bulging.
I see.
And the pain was just excruciating.
Now you have another complication though.
Yes, I am also a fibromyalgia patient and have been for a long time, and so I just tended to blame everything, any kind of pain, on fibromyalgia. But when it got to this point, I knew it was something I'd never felt before.
So we're talking
worse.
about intrusive pain, serious pain that stopped you from doing daily activities?
Exactly. It hurt to sit, it hurt to sleep. There was just no getting comfortable. And I had pain in both legs. It was...
So even sitting here like this would have been painful?
Yes, I could not have sat here this long.
So, well, you look terrific now.
Well, thank you. I am feeling 100% better. It has really been a miracle for me.
Wow. So you would recommend this treatment to...
Absolutely. I would recommend it to anyone.
And how many sessions did you have?
A total of 20.
Wow, and look at you, and you're feeling 100% better.
Yes.
That's fabulous. That is
Thank
really
you.
fabulous.
Thank
Well,
you.
thank you so much for sharing your story.
Thank you.
Everyone out there, stay with us. When we come back, we'll be talking to Dr. Graf and summing up about spinal decompression, finding out whether or not it's right for you. So come back and join us with Dr. Graf. For more information, you can contact Dr. Jason Graf. Spinal Care of Wilmington is located at 211 Racine Drive, Suite 202. You can call them at 910-798-5560 or go to their website, www.spinalcareofwilmington.com.
If you're interested in being a guest on HealthBeat, call 762-8581 or go to our website, www.aytv3.com.
Welcome back to this closing segment of the Health Beat edition of your hometown show. We're here at Spinal Care of Wilmington talking with Dr. Jason Graf, and the subject today is spinal decompression. Now, this is a treatment for chronic back and neck pain, and it is totally non-invasive. That means no drugs, no needles, no injections, and of course, no surgery. And the results are wonderful, free from pain in anywhere from 8 to 20 sessions. Now, we just spoke to 2 clients who have had tremendous results, from 80-year-old person who is able to go out and play golf again to a normal housewife and mother who was debilitated by chronic pain. But let's find out a little bit more about spinal decompression, how you might qualify for it, and what are the results that anyone can expect. Dr. Graf, can you tell us a little bit about the results of spinal decompression overall?
Sure. Obviously, I see the results every day, so I know that it works, but the general public may not be aware of that. It's a fairly new procedure. The latest research out there by Dr. John Leslie of the Mayo Clinic showed an 89% success rate with decompression.
Wow.
So there's nearly a 90% chance that we can finally end your pain once and for all.
And that's better than any other of the alternatives out there.
That's right.
That is fabulous and amazing. Well, I know that it was completely eye-opening to me that you could do this. And again, this is for back pain or cervical neck pain that is caused by a disc problem. Is that correct?
Right. Disc herniations, disc bulges, disc degeneration, sciatica, stenosis, we also treat as well.
Okay. And how would someone come in and find out if they were the right candidate?
Obviously, the best thing to do is to call our office. So once you call, we'll set you up with an initial consultation, and there's actually no charge for that.
Okay.
So when you come in, we'll go through your history, how this all happened and what you've done for it and why it hasn't helped you, and we'll go over any MRIs or x-rays you may have. At that point, we'll do an EMG scan on your back or your neck, and we'll do a complete orthopedic and neurological exam to determine if you are a candidate.
Okay.
So if you are a candidate, I'll get you started right then and there that day and get you some relief and on the road to recovery.
Okay, and how do people reach you?
Well, they can call the office at 798-5560, or our website is www.spinalcareofwilmington, that's all one word,
okay.
spinalcareofwilmington.com.
Okay, or of course, you can always reach Dr. Graf. Check our website under Ask the Experts. And thank you again, Dr. Graf, so much. It was fabulous to be here today. You guys, back pain, see Dr. Graf.